Thank you, Dr. Kluge, and happy World Polio Day to everyone. It is a delight to be able to spend World Polio Day in Copenhagen here today. And I'd like to begin with a small piece of history. I want to take you back to 1979, when one person in the Philippines said that and challenged members of our Rotary organization to say that we can eliminate polio off of our island nation. They worked hard for many years, but it was able to be done. Then the challenge was shared with the rest of our Rotary family, 1.4 million members around the world, to say, if we can do it here, can we do it everywhere? At that point in time, as we began to talk with other health professionals and organizations across the world, it was thought to be improbable. It was thought to be something that wasn't possible at all. However, we began in 1988, as you heard, to collect partners, the WHO, UNICEF, the CDC, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. And since that time, we have worked as the Global Polio Eradication Partnership together to ensure that we all bring what we bring best to the table. For us, as our Rotary family members, what we bring is advocacy. We are leaders, community leaders in our communities, problem solvers. And so we reach out, we work with our governments to ensure that the dollars that are required to eradicate this disease are placed forward so that everyone in our world can be safe. We're also fundraisers. We've raised collectively, our membership, since that time, $2.6 billion towards this effort. And so just last week at the Global Polio Summit, where the pledging moment took place to ensure that we have the funds to complete this task, we were able to put forward our next pledge of $150 million. During that time, $2.6 billion was pledged, and the $4.8 billion gap that we have to fund total eradication by 2026 is halfway to that mark. Many governments of the world have stepped up to say that they believe and trust that our partnership is going to accomplish this task. And I'm very proud of the creative ways that our Rotary members around the world every day, and particularly on World Polio Day, are raising funds through many, many means. They're pedaling for polio, they're raising pints for polio, holding fundraisers and auctions, raffles and dinners. All different methods of making sure that each person individually can do something to contribute to our polio effort. One of the best things that I think we need to take away from where we've been and what we've accomplished is the incredible public health infrastructure which has been created through the Polio Eradication Initiative. Along with our partners, we have created this infrastructure in dozens of countries around the world. And when the COVID pandemic hit, we were able to take our frontline community health workers and transit them into being frontline COVID workers because they understood the critical nature of surveillance, contact tracing, the exact things that needed to be done to be able to address COVID. But it's so much more than that. Polio for Rotary is our #1 corporate priority, and we will not walk away from it until this is resolved. But we also know that we call it Polio Plus because we're able to utilize that infrastructure to also make sure that we tackle other things like diarrheal illness, tetanus, all different kinds of tuberculosis, all different kinds of things, measles, that are taking place in real time. And so together with our partners, we're immensely proud of the progress that we've made. We are closer than we've ever been before. And while we see some setbacks, we knew that there would be some bumps along the way. But science tells us that we are tracking and tracing like we did when we were able to remove the endemic countries of India and the entire African continent 2 years ago. And we see that the 2 remaining countries of Pakistan and Afghanistan are trending and tracking in the exact kind of way. So we need to believe in science. We need to know that the cases, even though we see them in other parts of the world, are traceable, trackable, right to those original sources. And so, like I say, We are closer than we've ever been before, and I am delighted that we have an opportunity to be able to celebrate with our WHO partners in Copenhagen during this time, and look forward to being able to receive questions from any of our audience today. So thank you very much for your kind attention.